All right. Good afternoon. Today is October 2nd. Today we're trying out going live on YouTube. We've been doing this on Facebook for some time, but today it's time to switch over the platform to YouTube. Hopefully, that will be easier for more people to follow, as I've been getting a lot of responses to uh, have more access. And not everybody is on Facebook, or a lot of people have been on Facebook, but they've switched over. So let's try that. My name is Dr. Vikram Gupta. I'm a practicing family physician in Clifton and Patterson, New Jersey. I'm board certified in family medicine, and I've had experience in practicing in the hospital, in nursing homes, and in private practice. Um, and I have a lot of experience, at least 15 years of experience practicing in the US healthcare system. Learning the US healthcare system has been harder than learning medicine. So I'm sure a lot of the frustration that comes on both ends between the doctors and the patients is because the US healthcare system has been designed to be that way. It makes money for the system, so they're not looking to change this anytime soon. But I think that answering your questions about healthcare and about the healthcare system and a lot of knowledge that's out there on YouTube, WhatsApp, Facebook, um, what you're hearing on TV, what you're reading on your news. There's so much out there that people. There was a time when they felt like they were in the dark. They had no idea what was going on. To the other extreme now, everybody knows. Yeah, everybody seems to know what's going on, and they have answers for everything. It's a information and knowledge overload, uh, and I'm here to help you navigate that. A lot of the information that you have is probably correct, but um, it's very difficult to put it into context, into your context. Even if it's Chat GPT, it's very good at answering medical questions, but it still cannot put things in your perspective and what would be best for you. So that's where we still get stuck, and we a lot of my patients reach out to me that they still need my help, my advice in making a decision, trying to figure out what's the next step. And then when we put things in context, it's actually easier to explain to my patients what we're really talking about and where we're going with this. So we are able to use the knowledge that my patients already have to to help them understand better. So that's actually very good. So that's where I like to share my experiences, what I've had in the last week, what was interesting, what was more frequently seen, uh, and so forth. Um, so let's start with a few questions. One of the things that was commonly seen was a lot of questions regarding the new COVID vaccine and the other vaccines that are out there and they're being promoted. Uh, and So the frustration and the vaccine fatigue and just the information overload is a little bit overwhelming. So again, I don't want my talk, whether it's a podcast or a video cast. I don't want it to be more technical. I it's there's tons of information out there helping you understand this, and they'll go into significantly deeper terminology and physiology and pathophysiology and everything, how things work, why they work, and so you get to know more about the stuff. But I'm trying not to get into those details. I'm trying to have this video cast mostly like as if you were my patient and you were asking me a question. And again, this forum is open for as many people uh, as many questions from as many people that I can answer. I would love to answer. Just based on my experience in medicine and in the healthcare system in the United States. I don't know much about the practice of medicine in other countries. Medicine may be very similar, but health systems and how things work is different. Uh, but as far as the United States, big country, big healthcare system. So I'm here to answer your questions. Subscribe to the channel. You'll be reminded every time I go on live, and I'm posting some videos as much time as I can get, and try to make some videos for your information. I'll be happy to share. So first of all, let me talk about the new COVID vaccine. The new COVID vaccine, which is the latest and the greatest, and it's probably the only thing that should be available right now. So you don't have to say that I want the new COVID vaccine. You can just say I want the COVID vaccine, and you will get the new one. The old ones are not there, or they shouldn't be there by now. So should you get the COVID vaccine if you've already gotten the previous series and you've had like your two or three or how many boosters they had? The answer is yes. This one is newer. It covers the newer strains, but at least up until June, July, it covers those strains and it's shown to be effective. Mm, are we getting a lot of COVID cases? Yes, a lot of new COVID cases, and I'm seeing them in patients who are fully vaccinated, even they've had their boosters. I've mentioned it in my previous talks too that it's it's not as deadly as it was in 2020, uh, but we have seen a slight spike in hospitalizations with the older folk who do tend to get sick and get hospitalized around this time, whether it's with flu or RSV or COVID, and now COVID. It's quite reasonable and appropriate to get the new COVID vaccine. It's it's as safe as the previous versions. They have not reported anything, and then all the talk about like kids getting sick, heart conditions going up, and this happening and that happening. I think there've been more of the COVID vaccine given in 1 year than all the other vaccines combined in many years, and the side effect profile is pretty safe, and it's definitely not any worse than all the other vaccines that are out there. So if you do for well if you can, you should go get the vaccine because there's no due for the booster. This is a newer version, so everybody should just get it. You go to the pharmacy, you request it, and your insurance should cover it. And the insurance is supposed to pay 100% of the cost. But your pharmacist or your insurance can clarify that for you. What other vaccine is out there? The new flu vaccine. You should get the new flu vaccine. um, can you get them on the same day? Yes, you can get them on the same day. But if you got the COVID vaccine yesterday, now is it too late? Do you have to wait for 2 or 3 weeks? No, just get it whenever you can. They 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 don't really interact, and you should be fine. If you want to wait a week, you can. There's no rule at this point. The guidelines say that you can get all of them together and it doesn't matter. The new RSV vaccine is out. If you're over the age of 60, you should get that. Surprisingly, I did diagnose two people with RSV. I was suspicious for COVID. We sent out the test, and they all had cold like symptoms, cough, congestion, viral symptoms. So, and COVID has been changing. Sometimes they had loss of taste and smell. This time they don't. And sometimes they had a runny nose, and some strains they didn't. Sometimes they had diarrhea, but this other strains didn't. So, anyways, we still don't have a perfect definition of a clinical presentation of COVID. So, anytime I see any patient with the virus-like symptoms, like upper respiratory symptoms, I'm trying to get them checked for COVID, at least a home test, which is less accurate, but still easier to get done. So a test, something is better than nothing. Uh, so I was suspecting COVID, and they both came back with RSV, respiratory syncytial virus. Uh, in the adult community, we don't usually check for it as much because it's predominantly we see this in children. Children suffer a lot with RSV, and it's very difficult to watch your kids with, you know, the cough and breathing issues, and the poor kids are miserable with this. But in adults, we usually, because it's not very severe in adults, or it gets underdiagnosed, and so we sometimes don't realize. So maybe it very well might be. Uh, but now I saw a couple of these people who were sick, upper respiratory, turned out to be RSV. And so the thing is that the grandparents, there's also spreaders. So all the adults are spreaders of RSV, which makes the kids suffer much more um, in due to this. I should have so it's quite reasonable that if you're over the age of 60, get the RSV vaccine. Again, so far data shows that it's safe. I have not had enough experience with this to like confidently say. I'm just sharing what the data says about it, and uh, I think we should be okay. But for older adults, I think you should definitely get it, especially if you have got lung issues, COPD, asthma, or you've been hospitalized before for lung issues. Quite reasonable to get that done. Can you get it along with the others? Yes. And should you go get it? Yes. Should it be covered by the insurance? If you're over the age of 60, yes. So um, that's the take on vaccines. A bunch of them out. The answer is yes. And if you had to pick one, um, I don't know. Uh, because these conditions are presenting in very, very similar scenarios, that the hospitalization rate is expected to be similar, whether it's from flu, RSV, or COVID, or any of the other viruses. So I'm not really going to say, because if this question was asked last year, I would have said COVID, no doubt. But this year, now presentation of COVID, at least what I'm seeing, until like there's a new strain that comes out. I don't know, but then that's different. But until a new strain comes out, and mostly like the presentation is like what we're seeing now, uh, it's about 30% each. Although I've seen more of now, again, limited practice, but busy practice. I can't speak for CDC data, county data, hospital data, but what I've seen is more of RSV and COVID. So flu is weirdly silent, I'm going to say. Uh, but again, if you had to go get the vaccine, uh, it's fine, but go get the COVID one, because a lot of my patients have been okay with getting the COVID vaccine, but they don't want to get the flu vaccine for some reason, because I guess they've had experience and then they've fallen sick, and then they blame it on, falling sick after getting the vaccine. So they just don't want to get that. Um, COVID they got it, so they feel like they should get it. And RSV is too new, and it's out there. We're beginning to get that. So if I use that analysis, I would just go with whatever you're comfortable with. So if more people have been comfortable getting the COVID vaccine, so let's at least get that one, because COVID virus is still um, tricky. We don't know what the next strain is going to do and how bad it's going to be. So get the COVID vaccine if you have to. If you're going to only get one, but ideally get all three, you'll still be fine. And if you if you're going to get a little sick from that, getting all three is not going to make you three times sicker. It'll just be the same thing. So that's my take on these vaccines. Another thing. So Another interesting thing that I'm beginning to see now is I've had a lot of young students, college students, because they've been in college for about a month now. Um the excitement is settling in, the schools are settling down, and the studies and the expectations are becoming more clearer. And I've had like a few students last week just overwhelmed with the stress of school. They feel that they're not keeping up, they're not going to be able to keep up, and it's very hard. And it's just the anxiety that comes with the feeling that you're falling behind or you can't do it. It's almost like, you know, you feel like you're in the middle of the ocean and you're drowning, or you're not going to be able to keep swimming. And that's a terrible feeling. So I've just seen a few students come up with that, and I just want to tell you guys that, first of all, most of these courses are designed in two ways. One, they are not impossible, they are very doable, but they're also designed to weed out people who are not essentially doing it for the right reasons. Because it takes not just discipline, dedication, but also an inner desire or a passion to pursue that. And if you're not in it for the right reasons, the courses are kind of designed to weed those kids out. So first of all, I told my patients to ask themselves if this is what they really wanted to do, because if they did, then they'll be just fine. It's hard, but it's designed, and they pick these students who meet a certain criteria, and then they're going to pass. These courses are not designed to fail, but they are designed to weed certain students out who don't belong, or who never really wanted that, and they're doing it for whatever reason because it's popular, or their parents want them to do, or their friend is going there, so they're going there. So that's when some of the trouble happens. Like, if you ask yourself this question honestly, it does go a long way, and it's helpful. But now that's, past the inner thing. Is you're just a month into it. How do you really know if this is what you wanted to do? So you started, and it just turns out it's a little bit harder than you thought it was. Uh, Next step is talking to the counselors in college. Most colleges will have a robust support system, which includes other students, your senior students, and it'll have counselors and other teachers who all work with each other, because they are expecting kids to feel the way you're feeling. So utilize those resources, and most schools will tell you that that's one of the most underutilized resource in the college, because nobody feels that they want to share this with anybody else, and they feel like they're the only ones with this. But surprisingly, there's more people dealing with this than it seems. So utilize that resource, and you'll be surprised how much is out there for the students, especially the new ones, the younger ones, who just barely got their feet wet. Um, Third is, yes, reaching out to your doctor, uh, and you know, and then just saying it how it is. We can always look into other ways to support you or help you, and which is like, you can also, depending on what your background is, what kind of personality you are, like, have you dealt with anxiety and depression in the past? And that's perfectly fine. Different, people have different health history, mental health history, and so sometimes the school counselor helps you deal with the school, and they can help you, guide you, and help you with resources that are available. And then, as a physician, we can also guide you with regards to cognitive behavioral therapy, and see a therapist for your personal growth, and personally how you are managing this life situation. Is just another step in a long life ahead of you. So, a therapist on top of counseling in school can be quite helpful, and we can guide you to that. Occasionally, you might need medication depending on your past history, and or you're already doing therapy, and you might need some medications. Your doctor can help you with that. And last, the only thing that I want to add on top of that is, uh, this is the time when a lot of young kids start getting introduced to stimulants like Adderall and Vyvanse and Concerta. These are stimulants, and they keep you awake, they keep you more focused, and have a high level of abuse. Uh, Try not to get into that um, circle, or don't gather that advice that here, take this pill and you'll be able to study for your exam all night. uh, you guys are going to be doing this for the rest of your life. The studying is just the beginning part of that, and believe me, studying college is just the beginning. It tends to get harder later, but then you're being trained to handle the hard part. So if you start relying on medications to get you through every single day, you've got like a lot of years ahead of you to be stuck on these controlled medications. So I again, there are some kids who need that. There are some adults who need that. uh, but a good discipline, uh, and being honest to yourself, and a good study system, being regular, having a proper plan for how you're going to do this, is actually going to work way better than any medicines. So keep that in mind, and try not to fall for that crutch, is my honest advice. Um, uh, and yes, coffee is a stimulant, so you can actually drink a lot of coffee. Actually, wait, let me take that back. You can drink coffee, but sometimes you're gonna have to pull all nighters. So coffee is still better than probably Red Bulls and Adderalls, and the Prime, that was also lately in the news that they had too much of caffeine in there. So having a good cup of coffee or two when you're pulling an all-nighter, is way better than anything else. So definitely good, good things to try. Exercise and good sleep. It might sound counterintuitive, but if you're in the habit of getting good sleep, if you're well rested, the rest of your hours are much more productive, mentally and physically. So you actually get more done in those fewer hours than being perpetually tired or sleep deprived. So definitely some things to consider. Um, and that ties into the feeling of fatigue. And I got a lot of patients with sleep. I did the talk on sleep apnea, and since then we've diagnosed like I don't know, 20 more people with sleep apnea. So it was interesting, partially for me, because I started seeing more, and my medical students, they started seeing sleep apnea in everyone, even the ones you wouldn't suspect. And a lot of my patients actually came to me and says, "Hey, maybe I have sleep apnea because I have all those symptoms that I'm tired during the day. I don't wake up well rested. I'm always tired. I could take a nap wherever I get a chance, and I snore at night. I'm tossing and turning at night. My spouse or even everybody's they can hear me in the other room." So a lot of these things, interestingly, so I got a lot of patients with that. So we've sent most of them for sleep studies in the last week. So we'll find out soon how many of them actually have sleep apnea and what we can do about it. But the question was like why I even brought up the college and all that, because a lot of them were having issues with fatigue, feeling tired all the time. And I think most of this was attributed to sleep deprivation, not sleeping enough, and then obviously feeling tired pretty much all the time. And then when you are sitting at a desk like I am right now, and you're studying in front of a computer, and then you sleep whenever you can, like you, as in college, you're not getting enough sleep. Um, so a lot of people have started complaining of neck pain. This is a common complaint that I see in my office. Neck pain, most common cause, stress. And second most common cause is poor ergonomics. And ergonomics means how you're using your computer, how frequently you're using your computer, and how you're sleeping. Or is your pillow too thick or too thin? And are you a side sleeper? Are you you sleep on your belly? Those are These are all mechanical causes of neck pain, because you're straining your neck muscles that are basically go from the back of your head all the way down to your shoulder here. It's called the trapezius muscle. That gets strained because of you looking at one picture in a certain position, and these muscles trying to hold your neck straight. Something to definitely discuss with your doctor, uh, where you can work on some stress relief and some exercises to relieve neck sprain. I can demonstrate that at some point when we have a little bit more time, but definitely neck exercises using passive stretching. Um, Actually, using range of motion exercises. So if you use your hand and you push with this hand to the side, and you maintain that stretch for maybe about 20 seconds, then the other side, up, down. So that's four. One, two, and about 25 seconds each. One, two, three, four. And this one you're pulling with your hand down. This one you're pushing with your hand. you're pushing with your hand up, and so everything, all the work is being done by your hand, not you. You're not turning like this. You're not turning like this and then doing this. You leave it at zero and then push your hand, push, pull, and pull with this hand and hold that stretch. You can see these muscles stretching. And then this way, I'm just gonna pull until it starts hurting, or you feel that okay, you have enough stretch. You do that, and then so that was 6, and then last 2 are gonna stretch the back. So you face the opposite side and pull. So I feel the stretch over here, and then look towards the other side diagonally, and then you pull this way. So I feel the stretch on the opposite side. So that gives me 8 exercises, 8 stretches. If you could do that every day, whether you're studying, whether you're waking up, whether you're lying down, whenever you're feeling this, at least 2 times a day, two sets. That won't take you more than 5 6 minutes. Uh, Maybe 10 in the morning and 10 minutes in the evening, just for this. I promise you, at least 60% of you will stop complaining of the neck pain. Then you look into what's causing that. Like, are you on the phone too much? Are you holding the phone like this? Are you on a big screen? Are you looking at side screen? Are you doing a lot of these things? Something to keep in mind that you gotta relax this and keep your neck relaxed. So that's something for neck pain, which is very beneficial. Hopefully, at some point, I can do a better video on just this, because it's a game changer. And it's just a simple exercise can make such a big difference. But managing your stress, not being stressed, getting enough sleep, getting enough comfortable sleep, all these things will reduce the neck pain in the first place. And then that exercise works even better because you have less to fix. So that's, I think, all I got for today. It's 7 o'clock, and we've had our 30 minutes. Hopefully, I'll see more of you with more questions. Please subscribe to the channel. Share this with any friends who have questions for the doctors, who can't seem to understand what's going on, how to better handle situations, when you should get worried, when you should not get worried. I'm here to help you understand the healthcare system and your own health, uh, and helping you make better decisions when making decisions about your own health. So please share and subscribe, and I will see you next week. Thank you very much. My name is Dr. Vikram Gupta. I am a practicing physician in Clifton and Patterson, New Jersey. Thank you.